I'm Dr. Matthew Clark. I'm a clinical psychologist at Mayo Clinic and professor of psychology, and this is my colleague.
Kristen Vickers-Douglas, also a professor of psychology and clinical health psychologist here at Mayo.
So we're delighted to be here to have the opportunity to talk about a paper that we have that will be being published in Mayo Clinic Proceedings, the effectiveness of wellness coaching for improving quality of life. And we wanted to talk about two things. One is both the Mayo Clinic coaching model, and then also about some of the exciting research that we have coming out that's showing the effectiveness of wellness coaching.
Well, wellness coaching is really taking off, and more and more employers are using this as a benefit to help promote wellness in their employees. And some of the outcomes that have been focused on are what the employer is interested in. Return on investment, days at work, and we're really interested in looking at the patient or the person's experience. And because the coaching model really involves engagement and motivation and personally relevant goals, we want to get a sense of what matters to the individual. So looking at quality of life really matters. The Mayo Clinic Wellness Coach model really starts with relationship and engagement. So the idea with wellness coaching is it's tailored to the individual. And then using the science of goal setting, how do we help stretch them beyond their comfort level, but not too much that they're overwhelmed? Really finding targeted directions for behavior change. So I'm really excited because the science in this area is fairly limited, and we're really trying to identify important patient and person outcomes.
What's been exciting for me is I've worked with a number of people that have been through wellness coaching, and you can just see the growth and the changes in them. Mm-hmm. But from a research perspective, we just hadn't looked at, if we look at a large cohort of people, how are they doing? Yeah. And one of the unique things that our team is trying to look at is also how is someone doing from a medical viewpoint.
And for us as clinical health psychologists, there are people who really want some help and some support for behavior change, but going to see a health psychologist maybe isn't feasible, maybe there isn't access or resources, or there is honestly some stigma associated with seeing anyone affiliated with mental health care. And so to go to a place of wellness like our on-site employee wellness center here and have a coach sit down in an environment that feels safe and comfortable for identifying personal goals for wellness is more acceptable. So we're out to prove that it also makes really difference in their own quality of life and outcomes that matter for their health and well-being.
As a team, we're thinking we can either give people 100 measures and see if they change in the measure that they were hoping to change, or just to look at a broader category. And we've just been really interested in quality of life.
I think the study is important too, as this is an emerging area of science, and so we don't have the large-scale randomized controlled trials that compare wellness coaching interventions to contact control conditions.
So as a team, what we decided to look at was three kind of overall measures. One was quality of life. I'll talk about that first. Second was stress, and we looked at perceived stress. And then third is we were just interested in depression. With quality of life, what we've looked at as a team, we've defined it as there's this overall quality of life, but then there are also domains. So there's physical health, cognitive health, like how's my concentration and memory, emotional health, social health, and then one of the areas we've been really interested in looking at is spirituality. What we found in this study, it's a single-arm cohort. We just looked at people that signed up for wellness coaching and completed the 12 weeks of coaching. We're also looking at, we wanted people to maintain changes, because so many times you see people, I started a weight loss program, I lost weight, as soon as I stopped the program, I put the weight back on. So we wanted to see if you're in a 12-week program, 12 weeks after the program, have you been able to maintain those changes? And we found that people that completed the program experienced improvements in overall quality of life in all 5 domains. And what's great is we use these 0 to 10 point scales, and if people change about 1 point on the scale, so if my energy level was a 6 and now it's a 7, I would know that difference. And so 1 point change also has some clinically significant meaning, and that's what we found on all of the scales.
The coaching intervention itself was 12 weeks of face-to-face primarily intervention, meeting in a wellness center for wellness coach conversations, starting with really eliciting from the individual their priorities for wellness, which is different for everyone, and using communication strategies to help engage and motivate and move people forward on very targeted wellness goals.
The second main outcome we looked at was stress, and we used the perceived stress scale, which is probably the most widely used nationally and internationally scale. And we were just interested, one, what is the participants' baseline stress level like, and on our scale what we found they're about a 15, kind of national averages are a 13, so a little bit high on stress, and then at the end of the wellness coaching they were down to about 11, and then what was great at a 3-month follow-up, they're at down at about a 10, so it shows that we're kind of elevated and then we're lower than average, and we maintain that average at follow-up. So again, some evidence that just the wellness coaching helped the participants change their level of perceived stress. So what we've been asking is 0 to 10, what's your quality of life? 0 is as bad as it can be, 10 is as good as it can be. And the way we found people think of these scales, I don't have to have a 10 to have a good quality of life. I can have a 7, 8, 9, or 10. As long as I'm in that upper level, there's kind of that middle range, and then if I'm a 0, 1, 2, or 3, I probably have a bad quality of life. So the third area we looked at, we were just interested in depression, and again, not that we thought that wellness coaching should be part of depression, so we were interested in a couple of areas. One was, are we getting people that are coming into wellness coaching for their primary treatment of depression, and if so, maybe we need to do something about that. But we also just thought, if I have a history of depression, how might wellness coaching work for me? Is it a different outcome than someone who doesn't have a history of depression? And what we found is anyone that was elevated for depression at baseline was already in treatment for depression, and that's what we're hoping to find. And I know that's true because the two of us had to contact every participant to make sure that their depression was getting treatment. We didn't see a high level of depression on the PHQ-9. 4 is kind of the cutoff. If you're above a 4, you might have some symptoms of depression. But at baseline, our average score was about a 5, so some kind of mild depression. What was interesting is after the 12 weeks of wellness coaching, people were on average about a 2.5, which is a normal range. Anything between 0 and 4 is kind of minimal depression. And the participants maintained that at the 3-month follow-up. And so we found, what we think we found is that people knew not to go into wellness coaching for treatment of depression. They went to their physician or mental health professional first. But as their depression began to improve and they looked at their lives, they thought, wellness coaching might help me implement some positive lifestyle changes, and it seems like they used it appropriately.
In addition to the quantitative studies we have done on wellness coaching outcomes, we've also done some qualitative work, really interviewing and getting in-depth experience from participants in wellness coaching. So beyond these studies, I think our next step is to look at comparing a wellness coaching intervention to a contact control condition and really look to the next level of evidence.
In a single cohort design study, we found that participants that went through 12 weeks of in-person wellness coaching improved their overall quality of life and their quality of life in each of the 5 important domains.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.com. This video content is copyrighted by Mayo Foundation for Medical Education and Research.